Good morning. I'm Ganeshan. I am the Vice President of Micro Labs, Synapse Limited. Today we have congregated to commemorate the World Suicide Prevention Day, which happens to fall on 10th September every year. The latest survey shows that about 1.71 lakh people die of suicide every year. That means, in other words, almost 2 lakh lives are wasted through suicide. Now, suicide is more of a medico social issue because suicide is hinged to mental health. So, therefore, today we have one of the custodians of mental health. I take this opportunity to introduce Dr. Mahesh R. Gowda. He's a NIMHANS trained psychiatrist. He also runs a huge rehabilitation center called the Spandana Rehabilitation Center in Nantini Layout. And he's not only known in Bangalore and Karnataka and India, but much farther. So, Dr. Mahesh Gowda, with a first question, sir, in case you find a person coming with tendencies of suicide, what would be your advice to him, and how would you actually recognize this issue?
Good morning, Mr. Ganeshan. Thanks for having me here today. I think it's a very important topic to talk on suicide and prevention, and September 10th happens to be a very nice occasion for us to talk about it and coming to terms with the actual numbers that touch our heart here. When you talk about 2 lakh people losing lives, I think this is one of the most important factors simply because this is a preventable cause. And believe me, most of us who go through this crisis believe that we have the most difficult problem to handle. And we think that there's no direction of recovery from this sort of situation. And most people who think this way think that it's also good to, end their life. But most of the problems that we have are all temporary problems. And these are something that's going to pass. This is only a momentary issue. And most of them who have endured this sort of troubled times stayed up to this situation for some time, are able to move on, and they're able to find so many solutions, and lives becomes much more happy and pleasant as before. So this temporary discomfort is something that we must learn to endure, and all our efforts should be made to make sure this temporary discomfort is taken care of with all possible support system, be it medical system, be it family support system, be it friends. There are a lot of helpline that's available online also, but we must make sure that we induce this sort of hope to people. Anybody who feels that there's hope is ready to fight out and take the support system. Somebody who's feeling helpless, hopeless, and not feeling that there's a point to live will lose all the potential that they have within them, and they lose this opportunity to fight back also. I want to use this occasion and say that everybody has to thrive and live after this important factor of hope. Hope is the only thing that keeps us going, and the fact that when I move out of my house, there's no guarantee that I can come back home, but hope is something that makes me believe that I'm going to be back home. So I'm using this occasion to say that please don't lose this hope.
Dr. Mahesh, as you are aware, there are a lot of stigma around mental health and suicides. So as a family member and friends, how can we help someone who is struggling on mental health issues?
I think when you're talking about these important issues of stigma, this is not a new thing. But if you looked at what's really been a hurdle for mental health services and delivery is stigma is the most important obstacle to deliver any mental health care services or programs. I think if you look at what's happened in the last 50, 60 years, a lot of work has happened in this direction, and a lot of people in mental health profession, that is the psychologists, social workers, psychiatrists, a lot of good-willing souls have really worked hard and actually taken mental health care to the doorstep of a lot of people. Government's initiatives and policies are actually one step ahead. They have a lot of programs that actually happen at district level. A lot of programs are happening at taluka level, school mental health program, multiple things are happening. There's a lot of programs that happen on TV, media, a lot of conferences do happen, newspapers, periodicals. There are so many ways in which the information about mental health issues are being dissipated so easily. It's no more a taboo and stigma to talk about mental health issues. Depression is a very common word everybody uses now, and a lot of people feel that it's okay to feel depressed now. It's not that depression means it's clinical depression. Depression does not mean that he's sick to be hospitalized. So it is just like any other word. Talking more about it, making sure people understand that this sort of concepts is very important. Even at school level, a lot of teachers through the life skills program and a lot of other activities that happen, the awareness about stress management, having mental health issues and taking help also is being talked about. I think social media, the internet, all those things have played a vital role to make sure the information is available. And people do know there's something called mental health issue now. They also know that it's okay to feel upset, it's okay to feel frustrated, it's okay to have this sort of setbacks, it's okay to have a breakdown, it's okay to have relationship issues, it's okay to take help. And sort of help that is available is a huge range of services that's available. A lot of things are there online. Even if you don't want to talk to anybody, there's a lot of chat bots that you can actually interact with. They're all AI powered tools that give a lot of support in terms of people who want to interact and find out what's happening. So I'm sure we are progressing in the right direction. We have a lot of support system now, and stigma is an important issue, and we are able to deal with it in a lot more levels now.
Absolutely, Mr. Nawaz. So the question I wanted to ask was that, see, even though there's been a lot of growing awareness about the importance of preventing suicides and such, situations where the common public, they do not know how to deal with a suicide patient, or what they should say to a patient who is going to commit suicide. So any do's and don'ts you would like to advise to the viewers as to how to deal with a suicide patient, like what are the most important steps they should keep in mind when directly interacting with a patient who has a 50-50 chance of committing suicide?
Actually, if you look at, you don't have to be a trained person to say that you want to help somebody who's in a crisis. Most people who are upset and who are actually contemplating a thought of being suicidal and things like that are able to understand one important thing. They can easily make out who is faking, who's actually genuine. So the fact that you're actually there to listen to somebody, you don't have to really fix everybody's problem and give a solution and say that, this is your problem, do this, A, B, C, this is going to work. You don't have to do all those things. Just being a patient listener, actively participating in his whole discourse of whatever he wants to talk about is very important. You have to make him comfortable, give him the space required to share his deep down troubled emotional crisis and issues that he has. You have to create the wavelength of situation where he can actually feel understood there. Actively listening to what he's saying and actually asking for sort of small clarification, giving some sort of, some sort of hope in whatever you're discussing, and to say that it's okay to feel upset, it's okay that this is troubled times, it's okay that you're going through this sort of rough patch, but there are times when these things can also be handled and this can actually fade. All that you have to do is a lot of reassurance and be an active listener and be very supportive to what he wants to discuss, instead of being critical, instead of actually trying to dissuade him from talking. The more he talks is good for you. We have to just make sure we talk less and give him open-ended questions so that he actually gets an occasion to talk about an issue. So creating this important platform of being understood, being empathetic, to make sure you actually understand his problems well. So if you're very robotic, if you're very mechanical about it, it may not give in the required feedback for him to actually participate in this sort of discussion. So an emotional tone to the whole discussion is very useful in this sort of crisis. And whenever you have an issue like this, you don't have to think that you're the one-stop solution to all his problems. You also may need help. Make sure you mobilize help. A lot of NGOs work in this sort of area. There are a lot of helplines available. Calling a family, calling a friend whom he has trust with. You can ask him, whom do you really want to discuss? Who should be a part of this sort of crisis? You can ask him. He may give one or two names. He may say, don't tell also. But please encourage him to discuss and involve somebody in the family to handle this sort of crisis. And taking help is the most important step. He's asked for help, and mobilizing this sort of support system for him, creating a sort of safe environment for him also becomes important. When somebody is in a crisis like that, make sure that he does not have access to a lot of harmful things. It could be sharp objects, it could be pesticides, it could be access to balcony to jump off. If you think that there is anything that could be a potential threat for him to actually execute the plan of suicide, please look at these sort of situations with caution and try and eliminate this sort of dangerous objects. Suppose you cannot eliminate, just make sure he is there in a comfortable place. Make sure his location is at least changed. Don't leave him alone. Make sure you are always available. If you're not there, somebody else should be there to back you up and make sure there's an active listening happening. And whenever these sort of situations are there, make sure that you give him the required sort of solace and comfort. If somebody is actually feeling very helpless, simple things like breathing techniques, helping him concentrate more on the internal physiological process, like breathing, the 5 physiological senses, make him concentrate on some 5 important things around that he can actually see, 4 important things that he can actually hear about. Just making him aware of all the senses is also important. Make sure he eats something so that the taste receptors can be mobilized, and he can also make sure he focuses on some important things like what he can touch, what he can feel. So just getting the senses involved will also bring his emotions down to the current moment. So helping him focus on the current moment is important rather than looking at what's going to happen 1 month from now, 1 week from now, or 1 year from now. So getting him back to reality and the current senses will actually calm down his anxiety and worries also. So many times people would have mobilized and collected tablets to overdose themselves, or sometimes they would have taken a weapon to actually harm themselves. So just talking about it, and the moment you discuss and he says that this is my plan, try also look for this sort of objects and take it away. So I think it's important that at any point of time, you should not feel helpless. Even if you're feeling helpless, having a calm, composed demeanor there and making sure you mobilize the required help to handle this crisis becomes very important.
Exactly. Sir, the most important thing is, how does a common man recognize that a person is suicidal? Like, I'm a common person, how do I know so that I can help him out? So is there any tip that you could give us so that we could definitely act quickly?
I think it's a very important aspect to see who could be at risk for suicides here. If you look at a kid or adolescent in school times, the teachers and the parents have a window of opportunity to look at what's happening in the child's life. A child who's otherwise very cheerful, happy, doing well in academics can actually suddenly becomes dull, gloomy, trying to isolate himself, not participating in a lot of academic or physical activities like playing and things like that. He may not be so expressive. You can easily make out that he's not his usual self. And in terms of his enthusiasm to participate in the class, asking for questions, reciprocation, all those things can come down. He may also actually fall in his grades. The loss of interest will also reflect in his form of loss of grades. If he has close friends, sometimes they actually stop interacting with close friends also and try to isolate themselves. So many times people have a habit of writing diaries. A lot of people who are on social media actually have a status which actually could be indirect reflection of how they feel, what they intend to do also. So having an access to these sort of accounts also sometimes gives us an understanding what is going through. Somebody who's actually lost a parent, somebody who's had a medical illness for which he needed hospitalization, somebody who's gone through a parental separation. All these are important life events. Even having one life event in a life makes it very challenging for people. So people who are going through these sort of situations in their life are the people who could be otherwise depressed. People who are depressed can also feel that life is not worth living, and they may also think that it's better to kill myself when they're severely depressed. So many times they may actively talk about it and say, I don't want to live, I want to give up life. But a lot of other people leave certain telltale signs and clues. Sometimes they start giving away certain possessive, important, loud objects also. They start donating and giving it away. They start talking about life after me, what will happen. Sometimes they start talking, in case I'm dead, why don't you donate my organs and things like that. So people can keep this sort of telltale symptoms. Sometimes, though active, very easy to pick up, a lot of things can be assessed by their behaviors, feeding habits, sleeping habits. People who are sleeping well are the people who are much more, clinically stable. People who lose sleep and not able to get this sort of refreshing 4 to 5 hours of sleep are the people who are definitely agitated, more restless, more anxious. And people who don't sleep well also, get this sort of time to keep ruminating about it, thinking about it in isolation, because at night not many people are around. So these are the troubled times in which they can have this sort of thoughts and also get an opportunity to execute a thought. If you look at what happens with adults, most of things are similar. But with adults, the stressors that can be there in their lives could be different. It could be separation from a partner, it could be divorces, it could be loss of employment, it could be a lot of loans, financial crisis, it could be medical issues within the family, or he may have extended family, parental issues, educational setbacks, not being able to do well. A lot of other things actually can make him, prone to get into depressive crisis. A lot of us have skills within us, or this sort of survival skills or life skills that actually mask and prevent this sort of expression of harmful tendencies. But there are times when these sort of tendencies can be much more severe than what I can handle and cope with. So he can start feeling helpless, he can start feeling hopeless. All these things are evident from the way they deal with the situation at work, dealing with the people around in terms of the way he interacts and emotions that is there. The way of expressions in terms of the content of talk, all those things can also be different. In terms of eating, a lot of people have preference of eating. Suddenly they start losing interest in the most enjoyable, pleasurable dishes. They give up a lot of interest there. Sometimes people have substance abuse, so people may start drinking more. And generally, if you look at suicidal tendency, most of the people, though they say that trying to kill oneself is a cowardly act in England, I would say a person who's trying to kill himself, or a person who's actually making this sort of attempts, is not a coward. He's a person who has courage to kill his own life. The natural instincts that all of us have is to survive, and I will do everything to make sure I'm there and I'm alive. So if there's an instinct which is equally strong and more empowering to this person to execute that act of harming himself, it needs intense amount of courage. So it's not a cowardly act at all. It needs a lot of courage. And even if you look at people who are very anxious, who are very shy, who have not done any bold act, who cannot confront a lot of people in England, even these people can actually develop this sort of courage to execute and kill themselves. When people don't have courage, sometimes they use substances, alcohol, sometimes heroin, sometimes cannabis. So these sort of substances can actually stimulate their, senses, and sometimes they can give this sort of undue courage to execute an act of harm also. Though a lot of acts can be predictable, there can also be silent, smiling depressives sometimes. They don't even give you any clue. They actually plan everything so well. They collect all those things that they want to do, make sure there's no attempt that can be done to save this person also, and he makes sure he's so secretive, he makes sure he's locked at all times, and there's no access for people to save him also. So some people are there who are so organized to execute an act without giving us clue. That's also an aspect of suicide prevention. But most of the cases, the person living in and around, the relatives around, are able to pick up this sort of small subtle symptoms. Small changes can actually give a window of opportunity to understand what's going on in his mind. Somebody who's going through a troubled crisis is a person who needs to talk. So many times when you give them the opportunity to talk and discuss, they're able to ventilate and talk about their difficult emotions, and most of the time they want help and they're hesitant to ask for help. So if you give this opportunity, they're able to tell you exactly what they want. And sometimes it is very important to ask them, have you ever thought that it's better off if you're dead, and did you ever contemplate to kill yourself, and things like that will give him an opportunity to talk about it. If you're scared to ask him, and there's no hope of getting this sort of information at all. It is not going to induce a person to kill himself just because you're asking. So give him this opportunity to talk about it and volunteer to ask this sort of questions in a very subtle way, without actually being very judgmental.
Right. Sir, can you put it like this to our viewers, that life is beautiful, and say yes to life and no to suicide?
See, a lot of people have trouble and they say that, life is not worth living at all. But I'm here to say that, all of us have a wonderful life, and we have to say yes to life and no to suicide and these sort of acts. And if suicide and suicide attempts and killing oneself was a solution to people's problems, all of us have enough trouble. I may have more trouble that I have to kill myself 10 times a day. There are people who have 100 reasons to kill themselves, but none of them actually are attempting or trying to kill themselves. We all look at our life in different way. These are all temporary problems. We are able to find solutions to fix them, and I'm sure we are all going to come out victorious. Life is beautiful, and you have to say yes to life.
Thank you, sir. I think the key word here which you have used is hope. I think giving hope to people, counseling them on hope is what is most important. So at this outset, I would like to thank Dr. Mahesh Gowda for having given us a lot of insights on suicide prevention and the tips. And also very importantly, he discussed how an associate could help prevent suicide, particularly somebody with whom the person likes to associate or has confidence. And if that person is able to give that confidence and take him out of that environment, I think the job of preventing a suicide will happen. Thanks a lot, sir. It's a great pleasure to have you here, and it's a great pleasure to listen to your valuable feedback and tips and how you handle this kind of a situation. Thank you, sir.
Thank you so much.